comparing two things, that is the obstructive versus the restrictive. So the obstructive versus the restrictive diseases. So firstly we will dive into the obstructive disease. So what is known as the obstructive disease? So obstructive disease, here when you look at the pulmonary function test components such as the FVC. So FVC in obstructive disease is decreased. Next, when you look at the FEV1, it is also decreased, and there is a less than 80% of the predicted. Next, when you look at the FEV1, percent. So this is the FEV1 divided by the FVC. So this is decreased, that is less than 0.7. Next, when you look at the FEF, so FEF 25 to 75. So here it is less than 50%, which is predicted. Then moving on, we look at the TLC. So what about the component of the TLC? So TLC, if you see, it is normal as well as it is increased. Then when you look at the RV is increased. Now we are looking at the DLCO. So what is meant by the DLCO? So this DLCO, it is normal or it is increased in the asthma. It is normal or it is increased in case of the asthma, and it is decreased. So where is it decreased? It is decreased in the emphysema. It is decreased in the emphysema. So this was about the obstructive disease. Now we'll move on to the restrictive disease. So this is the restrictive disease. So again we are going to see in the same headings. So the first one is the FVC. So under FVC it is decreased, that is less than 80% of the predicted. And post this we also have the FEV1. So what is the FEV1? It is also decreased. And next, moving on to the FEV1, this is the percent, that is the FEV1 divided by the FVC. So here what happens is it is normal as well as it is increased, and this is nothing but greater than 0.7. So after this we look at the FEV 25 to 75. So FEV 25 to 75, it is normal as well as it is decreased. So now we look at the TLC. So what is this finding of the TLC? So TLC is decreased, whereas in case of obstructive it was normal or it increased. Then when you look at RV also, it is decreased. So TLC and RV, it is decreased in the restrictive, whereas in obstructive it was increasing. Then when we move on to the DLCO, so under the DLCO there is a decrease. So there is a decrease in the intrinsic. So there is decrease in the intrinsic restrictive disease. So there is a decrease in the intrinsic restrictive disease, as well as there is a normal in case of the neuromuscular. So there is normal in case of the neuromuscular or the musculoskeletal restrictive disease. So this was about the obstructive disease and its comparison with the restrictive disease. To learn and grow daily, please do subscribe.